New information on the Biden administration's plans to end the COVID-19 national and public health emergencies on May 11th. The end of these declared emergencies will mean the end of free tests and treatments for many Americans. Other social benefits that helped the nation cope with the pandemic will also come to an end. Gloria Pasmino joins us live now with highlights on the impact this will have on you. Gloria.
Dan, and the good news is that there's still time for people to prepare. The emergency order will not be lifted for another 3 months. The bad news is that a lot will be changing in terms of those free benefits that people have been getting. So it's very likely you will soon have to start paying for tests, for COVID vaccines, and even treatment.
After more than 3 years, the COVID national and public health emergencies will officially expire in the U.S. on May 11th. Jen Cates, Senior Vice President with the Kaiser Family Foundation, says that even though some of the health and social benefits put in place at the start of the pandemic will end when these two emergency orders expire, they don't represent all of the measures put in place. There is one big change: access to free COVID home test.
Whether you are a Medicare beneficiary or Medicaid or private, that's going away with the end of the PHE. And so getting tests when you need them might be more challenging, and you probably have to pay out of pocket in full for a home test, or you might start facing cost sharing.
Kate says to expect more cost sharing around certain therapeutic treatments as well from your insurance. So who will be impacted the most once these emergencies end in May?
The uninsured and those with insufficient insurance will be the hardest hit, as has always been the case in our healthcare system. They stand to lose the most. They do not have a guaranteed access to these things.
But Kate says there is one thing to remember. Even with these declarations ending,
everyone with insurance, virtually everyone with insurance, will get free vaccines, even after the federal supply is gone, even after all of the emergency declarations are over.
So that last part is key, because vaccination, of course, will continue to be one of the best ways to prevent infection, to prevent other people from getting sick. And many of those lessons that we learned over the last few years, masking up when we're sick, perhaps masking up when we're in very crowded places, and of course, testing if we think we have been exposed or if we are not feeling well, those two will continue to keep us healthy and keeping others from getting sick. Dan?
Yeah, Gloria, you mentioned those test kits, which might be in short supply. Should people stock up on the at-home tests now?
Yeah, and that is certainly a concern, especially if for whatever reason we start seeing an increase in cases. Now, experts do recommend that this is a good time to go out there and stock up on your tests. You can get up to 8 free tests from the federal government. So it's a good thing to put in that request, get your free tests now. And the only thing to remember is that you should just keep track of the expiration date on those tests, because the FDA does not recommend using tests that might have expired. So get them while you can. Keep them in your home in the event that you might need them. Just remember to keep track of the expiration.
Great advice. Gloria Pasmino, thank you with the latest on how the end of these COVID emergencies will impact all of us. Appreciate it.